Control, this is Tango 354 on call 43. I'm at the location given over. Is this him? The drowning man? I take it I'm not needed then?
No, sorry, mate.
Right now, we're here to make the council wake up and give the people who run Wally Point the funds they need. Yeah. Now, I'm not talking about luxuries like coloured tellies and fancy food and that.
You're absolutely sure you're up for this?
I'm fine, honestly.
You've got your mobile.
Matt, stop fussing.
Well, decent turnout.
Very decent.
You definitely haven't seen him?
Not for days.
Righto, let's get started then. Come on.
I'll leave you to it.
Get some sleep.
Come on, we're off.
Come on,
Lesson more, the long and the short and the tall. Bless all the planets and W01. Bless all the... It's a long way.
Can we please get a move on?
It's a long way to Tipperary, to the richest girl I know.
Oh my God. It's your fault. Sorry, you told me.
Ivan, I know it's cold outside, but you know this is not a hostel. You know it's not a...
Oh! You're getting slow, Graham.
You're going to love the night shift. It has a charm all its own.
Yeah, it's about as charming as a rectal probe. Come on, this way.
Thought this was supposed to be a gentle stroll, not a flaming death march. Pack up your troubles in your old kit bag and smile, smile. Ah! Oh!
What happened?
My back's gone.
Listen to me.
Yes, stand. Just get me on my feet. Ah! Oh! 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 Oh!
I'll call an ambulance. Oh, there's no signal. Ambulance. I'm with someone who's elderly, and he's fallen over, and I think he might have broken his hip. He can't move.
Dr. Hannah, the ambulance has just gone out for a serious spinal injury.
Oh, you have got to be kidding me.
Okay, people, let's make a bit of room.
Step back, please. Thank you.
Thank you.
Okay, hello. I'm Dr. Hannah. Can you hear me? Yeah. Can you move your feet for me?
Pulse 80, BP over 90.
There we go. Right, we're going to get you some pain relief and get you to hospital, okay? I'll get the morphine. Can you collar and board him and find out who's in charge?
What's your name again?
Can someone tell me who's in charge, please?
Okay, stand.
See, this outfit's working for me. Very Spandau Ballet.
Bit before my time, that.
What are you doing here?
I'm on call. What are you doing here?
I'm a basics volunteer.
Are you joking? Interesting. I had you down more as a what's in it for me kind of guy.
You know, somebody's got to do it. People will insist on getting into scrapes at unsociable hours. What's with the glasses?
Oh, before you make some really unfunny joke, I didn't have time to put my lenses in. I know they're horrible.
I was going to say they're quite nice, actually.
Really?
No.
Why are you here?
What, is this it?
Yes.
Chinese whispers. Control gets half a dozen historical calls.
I could be at home in bed now.
Organisers over there. Walker said she was pushing him a bit too hard.
What's her version?
Why didn't you go and find out?
Good luck. She's a bit loopy, to be honest. A bit hyped up.
Okay, I'm a doctor, I'm here to help you. Calm down, I'm here to help you. Calm down! Okay? Okay, I'm a doctor. Right, you've hurt your leg very badly. I need you to keep still or you're going to make it worse.
Where is he?
Okay?
Where's he gone?
Hello, this is Tango 354. I have a female, about 40. She's had a fall of approximately 20 feet. Keep still.
All right, we're just going to lay him on his side and let him sleep it off for now.
Don't we need to work out what's wrong with him?
He's drunk, that's what's wrong with him.
Doesn't he need IV fluids? Plus, we should take blood for LFTs, and what about a chest x-ray?
Okay, first, he's had all the tests done already. This guy's in here every couple of months and always with the same thing. In winter, he virtually lives here. How's the leg, Ivan?
It's itchy.
Yeah, but his condition could have worsened.
Yeah,
Okay, what colour is he?
What's his colour got to do with anything?
I mean, is he yellow? Is he jaundice?
He's not blue as well, so his airway's fine. BM's normal.
Roll him on his side and let him sleep it off. Thank you.
Take it the mentoring lurk is wearing a bit thin.
This guy just needs to be brought down a peg or two, seriously.
It's itchy. Itchy, that's what it is.
Lovely singing voice, Stan. Give us another one.
Please, take him to cubicles.
All right.
Sorry, are we keeping you up?
Oh, whatever you know, I'm flat out, Zoe.
Oh, yes, so I can see.
Oh, my grandma used to have specs like those.
Oh, very funny.
Sexy glasses.
And suddenly everyone's a comedian. I wish I stayed in bed.
Actually, buddy, there is something you can do for him. Come here. Lay on a cleaning trolley, plenty of large surgery pads, and take the air freshener in with you. That leg's going to need cleaning up, and it's down to us.
Us?
You!
No, where's yeah, it's itchy. Yeah. Don't.
Go and get yourself cleaned up. Then come into my office and tell me what's been going on. He shouldn't have left Lloyd to deal with Ivan on his own.
Well, he's playing games, isn't he?
I'll give him games. Right then, Ivan. Let's have a look at that leg of yours. Staff Nurse Foldren?
Yeah. Right, okay, let's have a look. Ruth?
What do we do?
Just get the door, yeah? Oh, come on, this way.
Okay,
You're
retreat to recess.
Okay, I've got you.
What does that mean to me? You're in safe hands, Rachel.
Thank you.
And you.
Never mind that.
Having problems breathing. Yeah, absent breath sounds on the left. It's a pneumothorax. You have a collapsed lung.
Let's have a look at this. Arm's pierced right through. Bone's been shattered.
Okay, sitting forward. Right, I want 6 units cross-matched immediately and a fast scan to exclude any pericardial trauma. It's a pity neither of your mentees are here to watch. Okay, back.
She has a bimalleolar fracture of the ankle and her calcaneum's been smashed. GCS was 15 throughout. I have given her 5 milligrams of morphine and an antiemetic, but no sign of head trauma.
Thank you, Doctor. Sorry, Rachel, I know this is a bit uncomfortable, but we have to clean the wounds up the first step. And that's about it. Well done, Scarlett. We've increased your pain relief to make you feel a bit more comfortable, and we've contacted your husband.
When you fell, you landed in an upright position and crushed your ankle, you understand? She was being followed by a man.
You're safe now.
Yeah, you sustained serious lower leg injuries. We're going to need to get you into emergency surgery.
But I'll be all right, though.
Eventually, hopefully. Have you eaten recently?
Indian, it was, tonight?
I really wouldn't know. She's going to have to wait until the morning for the operation. In the meantime, let's get a back slab on that leg and get her up to CDU. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Thanks. Breathing a little better? Well enough to tell us your name.
Luke Mason. I need to call the police.
They've been contacted. There should be someone here soon. Can you tell us what happened?
I was attacked over by the university. They tried to rob me. I mean, I should have just given them the cash and walked away, but...
Yeah, that's what I'd have done.
But I just snapped. I thought, no, you're going to have to fight me. And then I heard this bang, and I looked down, and there was this hole in my arm. I grabbed one guy, but the other one got away. I was so fired up, you know, I didn't feel any pain. And the next thing, I just couldn't breathe. And, well, that's it, really.
Who brought you to hospital?
Me, I walked it.
It's a hell of a long walk, man.
How serious is it?
Very, Luke. You have a large nail embedded in your chest.
A nail?
Yeah, it's passed through the lung and it's lying very close to your heart.
You attacked me with a nail gun?
I'd say so, yeah.
Am I gonna die?
Well, we can treat it, but you're gonna have to have an operation.
What kind of a sicko attacks someone with a nail gun?
Hi, can you fast bleed cardiothoracics to Rhesus? Yeah. Oh, Jay, word of advice. This is an ED, not a playground. It's not the right place for settling scores.
What are you talking about?
That little stunt earlier with Nessa CK?
Oh, yeah. That was funny, though, right?
You were being immature.
Me? Immature?
Hello?
He started it.
Yeah, it's Dr. Winters. So this man who's been following you?
Wants to help. He's been in my house, in my bedroom, everywhere I go. He's there.
Have you spoken to the police?
Not interested.
No.
Sorry.
Dr. Lyons.
Yes. Oh, for me, right. Thanks. Probably got too much barley wine.
No, not exactly. The night staff at the nursing home found her having a rheumatologist.
Okay.
Suffering severe abdominal pain, so they called us.
Looks like they did the right thing, then, eh?
It's not as simple as that, exactly. She's made a living will. So we need to respect her wishes.
Oh, no.
Right.
I shouldn't be here at all.
OK, Luke, the X-ray and ultrasound confirmed the position of the nail. It's gone a little way into the heart, but not enough to cause a problem. Now we need some idea of your medical history, so we can pass it on to the surgical team. Any allergies?
Not that I know of.
OK, you want any medication?
Nope.
What about this? It looks recent.
It was my appendix.
Your appendix? What were their complications?
Yeah, it was pretty serious.
OK, was that done here?
No, St Lawrence's in Truro, that's where I'm from.
Cornwall! Love it there. Is there anyone you want us to call for you?
Sandy, the wife, she's pregnant, expecting twins, so...
Twins, eh? You are going to be busy.
Yeah, she's been having a rough time of it recently. I don't want to upset her or frighten her. I work nights, so I'll call her in the morning.
Cool.
Sergeant Miss Pauldron, can I have a word? Can you spare him?
Yeah.
Lloyd, I'd like you to stay and assist Dr. Winters. It should be a good learning experience. I thought you'd like to know that I cleaned up Ivan's leg and changed his dressing. You know, for well, you shouldn't have left Lloyd to deal with that on his own.
I thought he was ready. He'd done a 6-week placement in a league of
Come
Forms.
on, Jay. I know you weren't keen on mentoring Lloyd and Scarlett.
That's not true.
Perhaps you prefer it if I found someone more responsible.
Look, it's not that I don't want to do it. It's just...
Is that it?
I don't know what he told you, but he does not respect me.
And do you blame him? Get back to work.
Right, Shirley, I know what you've written, but we're going to need to treat you.
Can you make the cancer go away? Then I don't want any treatment.
This is a medical emergency. You're really not well.
Okay. No treatment. No resuscitation.
Fine. I'll set you up with some pain medication that you can control yourself, okay?
Where are you from?
Scotland.
I know that, you bambot.
Sorry, I was born in Glasgow.
I'm from the Gorbals.
Yeah? So what brings you all the way down to Holby?
Train?
Aye, me too. Right, okay. I'll get you moved as soon as possible.
Are you sure this is what you want?
Oh, what I want is to be in my own bed with my own things. I had it all planned, even the music.
Can I ring your family for you?
I'm 90. Everyone I care about's already gone. I've outlived my own children. I know what's happening to me, and I'm ready for it. I'm not scared.
Right, Shirley, we've got you a place on a ward. Be a bit quieter and a bit more comfortable for you there.
I want to stay here, listen to the folk.
Well, at least let me get you another pillow and something more comfy to lie on than this trolley. Okay?
Yeah.
Your patient, Stan?
Yeah?
Mrs. Greer would like to know how he's doing.
Oh, he's got severe contusions to his lower back. Hello, Mrs. Greer. I'm Dr. Hannah. Stan's got some bruising. It looks a sight, but he's fine, really. No broken bones.
Thanks.
If you need anything, we'll just be outside. What are you still doing here anyway? I thought you'd be tucked up in bed.
Sleep's overrated.
You wouldn't lend me £1, would you?
No.
You really can't relate to people, can you? I mean, this is not an act. Lend me £1. I need some chocolate.
Well, you insult me with one hand and with the other you try and cadge money from me. You are incredible.
So I'm repeatedly told.
It was not a compliment.
Oh, come on.
I want the change.
Thank you.
Okay, what's wrong? What's wrong? It's okay. No. Calm down, calm down.
Have you seen anybody?
No, who?
Who was here? Who was here? Lie back down for me. Lie back down for me. It's okay. There's nobody here.
Will you stay with her? I'm going to call security.
Yeah, sure. It's okay, Mrs. Greer. I'm going to give you something to relax you, okay? Your bag. Okay. Chlorpromazine. Is this on prescription?
Hey, Chai, Case with a nail in him. What's that all about? Get this, right? Attacked by some kids in the park with a nail gun, puts up a fight, bang.
Yeah, Charlie.
Yeah.
Did you organise a bed for Shirley?
She's refused it.
What, so she just gets to die there? That's nice.
She doesn't want us to treat her. All that's left is for us to care for her. If that's what she wants.
Charlie, is the number for Shirley's care home in the file?
Yes. Scarlett. Let's get a couple more ticks on your competency form. I've got a nasty rash and a pre-tibial laceration with skin loss for steri strips.
Sounds terrifying.
You'll be fine.
You didn't get a good look at them?
Like I said, it all happened so fast.
What about the guy who whacked you?
Yeah, him. He was white.
Mm-hmm. Anything else?
Oh, it's all a bit hazy.
Well, you've been very helpful.
I think he needs to rest now. I'll see you out, okay?
We'll get somebody over to where it happened. Maybe I can find some witnesses.
Can I help you?
I'm here to see Rachel Greer.
Who let you through here?
Look, I'm just here to see my wife. I've had a message that she's been involved with an accident.
Right, you're her husband. Can I see some ID, please?
Yes. Matthew Greer? Matt Greer?
Right, okay, thank you. Your wife has had a very serious fall. Now, it seems she was being followed. We think the man may still be here in the hospital.
There is no man.
What?
He doesn't exist.
You're saying she's making this up?
No, not in the way that you mean. Look, I mean, there is a man. For Rachel, he's real. Absolutely, completely 100% real. All I know is he only exists in her head. Nowhere else. Can I see her?
Yeah, go ahead. She's on chlorpromazine.
He came back.
No, Rachel, you told me you hadn't seen him.
He was chasing me.
No, he wasn't.
I want you to go now, please.
I'm not going anywhere. Could we have some privacy?
I want you to go now.
I think we should leave Rachel alone to rest now.
How is she?
She's not looking good.
I'm dying, not deaf.
Ear trouble. It's rude to eavesdrop. See, while you're at it, can you make sure she's had enough morphine?
Yeah, that's fine. Could you just call me back with whatever you have on Mr. Mason? Thank you. Cheer up, it might never happen.
It will, but won't it?
Oh, it's something I said.
Usually, yes. Strangely, this time, no.
Must be losing my touch.
You want to hear them out there?
Who?
Everyone. All the staff going on about what a hero you are. What are you doing, man? You're not doing that right. Excuse me.
What were they saying?
All about how you stood up to those guys. Facing them down even with a 6-inch nail in your chest. Do you want to concentrate, yeah? Less blabbing. Up to you.
I had enough, you know. Sometimes you just got to fight back.
Sorry to disturb you. Jay, is it right? Yeah. The reason I popped in, me and the others, when we were talking outside, and we just wanted to wish you luck for your operation and to shake your hand. The good one, obviously.
Okay, the cardiothoracic surgeons have had a look at your x-ray, and... Do you want something?
No.
They'll be down to see you shortly.
Reclaim those streets.
All we can do is monitor her and make sure that her pain relief's working. If there's any change,
Yes, I'll let you know.
then straight away, please.
Okay.
I don't know how you managed to keep smiling.
Here's a practice match. Watch.
How's it going?
Yeah, well, we've been to the location where Mr. Mason reported the attack, but nobody saw anything. This is strange, because it's a very busy part of town.
Yeah, I've been thinking about that.
Go on.
Well, his injuries are so severe that I don't think he could have walked that far. In fact, I'm sure he couldn't. So, it must have happened closer to here. I mean, he's in shock, you know. It's not unusual for people to confuse distances, times, that sort of thing.
Is there any chance I can have another word with him?
Let me just see if he's up to it.
Okay. I'll give you a bit of time.
Dr. Winters. St. Lawrence here?
Oh, yeah. Hi, yeah. Sorry, could you repeat that? No, you've been very helpful. Thank you.
Everything all right? You seem a bit bemused.
Is there not something you could be doing?
Well,
Mr. Greer, I don't know your wife's history, but these hallucinations are clearly having a detrimental effect on her life. Is there something you want to tell me?
Well, I first knew something was wrong when she started to have these night terrors. They came out of nowhere and they were really, really bad. her eyes would roll and...
REM.
And then things just spiraled. She has this strange thing where she thinks that the place that she's in is also somewhere else. So, like, our house here would also be in Manchester.
Has she had any tests, brain scans?
They didn't find anything, so she ended up seeing a psychiatrist.
And the chap that she sees, the hallucination, are there any others?
Yeah, first it was children. She'd hear them playing upstairs. And then there was a cat that she'd hear scratching and crying in our wardrobe. But we don't have a cat or children. I'm allergic to them.
Children or cats? And the psychiatrist chap, what did he diagnose?
Anxiety and depression.
And the chlorpromazine?
That's new. It's just supposed to help with the episodes.
Right. Can't stand here chatting.
You're not real.
Get some help in here!
Get off!
Legs down.
Get off! Get him out of here! Get him off me!
Okay.
I want to go home. It's time for bed.
Right, this is a much more violent episode than last time. We need to get her back on the bed.
Yeah, I'll call for some help. Maybe Charlie can spare us somebody. We can't leave her alone like this again.
Okay, ask for the new nurse. I don't know her name. She looked kind of gormless. She seemed to be comfortable with her.
Right, I'll ask for the gormless one then, yeah?
You know what it's like out there. You just got to be able to look after yourself.
Believe me, I know. Some seriously bad people just looking for their next victim. Haven't I told you? Less yakking. You might actually learn something.
Listen, Dr. Winters, I just wanted to thank you for, well, you know, everything, really.
Nurse CK. There's a policeman in reception. Can you find him and make sure he doesn't leave? Tell him I need a word.
It's worse than you thought, isn't it?
No, it's not that. I gave St. Lawrence's a call.
You checking up on me?
We needed to know your medical history.
It's not what it looks like.
What does it look like? Ruth? What's going on?
You're about to undergo a major operation, Luke. Is there anything else I need to know about?
It's a coincidence.
Hang on. You did this to yourself? What, the nail? Your face?
You don't understand. Look, I can explain. Please, Dr. Winters, don't tell the police. I've done a stupid thing.
Okay. If anything at all changes, you call me, okay? She's in safe hands. Page me if she wakes up.
I was thinking about REM, sleep behavioural disorder, you know?
Yeah, when people act out dreams, often violently. Yeah, no, she hasn't got that because hallucinations are happening when she's awake.
Correct. Are you going to listen to me?
Yeah.
Right. At first I thought it was early onset Alzheimer's.
And it's rare in someone so young.
But not unknown. I've known people in their early 30s getting it.
Yeah, I know
What
that,
really
but...
got me thinking, though, was the night terrors that got me onto REM, sleep behavioural disorder.
It's not a typical symptom of Alzheimer's, Dylan.
Exactly. And neither is what happened to her when she was given the antipsychotic drugs, which is what led me to Lewy body dementia. Huh?
Inspector, can I have a word? Sorry.
How's she done?
Fading.
You all right, Shirley? You were supposed to call me if she deteriorated. Did you even come and check on her?
Yes, of course I did. I'm sorry I didn't call you.
All right, you two.
Look, I know it's been a long and difficult shift, but can the two of you please cool it?
Linda?
The last thing she needs to hear is us all arguing, isn't it? Why don't you take a break, have a cup of tea or something?
I'm Shirley's care home.
Sorry, Charlie, it's just...
It's not me you need to apologise to, is it?
What happens if these nutters with a nail gun don't get caught?
They won't be. The guy's a con man.
Jay.
The guy's a man who nearly got killed standing up to a pair of scumbags.
Oh, you think so? Well, have a good look, man. Because he's taken everyone for a ride.
So there's no treatment?
Well, there's treatment, but there's no cure. Dr. Hannah.
There are a lot of ways you can handle this. There are drugs available for the sleep disorder, dementia, even the hallucinations.
I work with old people. I know about dementia.
She's not going to die, is she?
Well, we're all going to die.
We're talking years here rather than months. It's a progressive condition.
How many years?
The average is 5 to 8. But that's not to say it can't be 20.
And these drugs...
Well, sometimes the problem is that the side effects are worse than the hallucinations. Is he here now, the man? Talk to him. Come on, he's your hallucination. Take control.
Can I?
I can explain, you know.
So can I. The whole thing's a compensation scam. You're a criminal, Luke. And you know what? You've been found out. You deserve everything they throw at you. That sound about right? Oh, no, you don't.
Wrong, it wasn't about the money, you don't understand.
You're gonna kill yourself.
So what? No one cares.
What the hell's going on? Luke? What you doing, mate? Just let him go and we can sort this out. Luke? Talk to me.
I'm so sorry to cause so much trouble.
It doesn't matter, mate.
Yes, it does.
What I said.
Lloyd, tell him everything's gonna be all right.
Luke. I'm not gonna lie to you. What you did was wrong.
Lloyd!
Everyone's gonna hate me.
Not us, mate. We're not here to judge you, okay?
I can't talk to the police. Forgive me. Please don't make me.
Okay. Okay. It's all right.
Right, he's going! Engage Dr. Hannah and fast bleep cardiothoracic.
He's really not here.
No, he's really not here.
Excuse me, sorry, Dr. Hannah, they need you in resus now.
Okay, I'll be back.
Okay, can you stay with us, please? We need to keep her talking. Come on, just talk to him.
I can't.
Just say anything.
I'd like you to stop this, please.
He's not going to hurt you, I promise.
Tell him how you feel.
What do you want?
Just say what you're feeling.
I don't want you here.
Come on, you can do better than that.
I want you to leave, disappear.
Has he gone?
I don't want to look at you. You're disgusting. Turn around.
Say something else.
Touch your nose.
Yeah?
Hey, you got some kind of a death wish? Guy puts a pair of scissors to your neck, you tell him what he wants to hear.
I don't lie.
Oh, you're quick enough to pass judgment, aren't you?
And you didn't judge him?
What do you think? You're some kind of superior being? Because let me tell you, you are not.
Excuse me.
Lloyd, hang on. You've had a shock, okay? If you need someone to talk to, then...
It's fine. It's fine.
Okay, maybe I shouldn't have banged on about him being a con man like I did, winding everyone up. It wasn't very professional. And all the stuff with Ivan... I'm sorry if I... Lloyd, man, all I'm trying to say is you're no good to any of us if you're dead.
Look, no offense, yeah, but I just need to be on my own right now. Try and get my head around all this.
Look.
Big Mac, have you got an MP3?
Of course.
So you know how to download songs?
I do, but I probably already got what you're after. You see, I collect classic tunes. I've got every Eurovision winner and runner-up pretty much from the beginning of the show. Dana International, my particular favourite. She's a fine-looking woman.
Really? That's amazing. Can I borrow it?
It's at home. I could fetch it in
Here's
for
a
you.
nice piece of advice I got from an old fishmonger.
It's okay.
When food is scarce and you see the hearse, you know you've died of hunger.
She's sleeping now.
This is that number I was talking to you about. I really hope it works out for the two of you.
I don't think there is a two of us now. I was going to leave her, you know, before all of this started. I think I was just too scared to leave, or maybe I stayed out of pity. Or guilt.
But you didn't leave, and you're here right now. That's what matters.
I'll let you get on.
Stan, this is Shirley. Shirley, Stan. Thank you for this, mate.
Oh, Danny boy, the pipes are calling from glen to glen and down the mountainside. The summer's gone and all the flowers are dying. 'Tis you must go and I must bide. Don't know anymore.
Sing it again then.
Oh, Danny boy, the pipes are calling from glen to glen and down the mountainside.
She's gone.
Do you think she heard it?
Hope so.
Yes.
Hey, do you have a moment? Okay. I've been thinking about what happened earlier, the trick I played on Lloyd.
Okay.
And I don't blame him for dropping me in it with you. The thing is, though, I'd like to give it another go. You know, mentoring him and Scarlett.
Give me one good reason why I should reconsider.
He's a good nurse. They both are, or they will be. And I'd like to be part of the process. And, to be honest with you, I think I've got a lot to offer.
You need to pull your socks up, Jay.
I know.
Do you?
Yes, I do. Really.
I'll give you one more chance. One more chance. Mentoring is like a two-way street. I know at times it feels like a burden, but it teaches you things about yourself, your strengths, and your limits.
Okay.
And for the record, Lloyd didn't drop you in it.
What?
What? Didn't take a genius to work that one out.
Morning. If I ever end up like that, will you do me a favour?
Shoot you?
Both barrels.
With great pleasure.
Want some? When you back on shift?
Oh, that's unpleasant. 45 minutes.
Fancy grabbing a drink? I'm not asking you out on a date, Dylan.
You know, when you asked earlier on why I was a basics volunteer,
Did I?
Yes, I think so. And you asked why I was here rather than at home, tucked up in bed.
Oh, well, if I did, which I didn't, I was only being polite. I know that's an alien concept to you.
Right, well, you did. You definitely did. The reason is when I'm on call, when I'm here, I can't have a drink. I have to stay sober.
Don't we all? Crap, I know. How are you doing?
Outstanding.
I didn't realise you... Wow, 12 steps and all that.
No, I'm not an alcoholic. I just, well, people say when I've had a drink I get a bit arsey. I know, it's tough to believe.
Well, I only meant coffee.
Oh, by the way, you owe me £9. Technically it's 10, but I'll let you off for one.
I won't stay long. Exactly. Thank you. Hi. We thought you might want to keep this as a souvenir. So we contacted your wife. Took a bit of finding. When did she leave?
About a year ago. A year ago yesterday. It's not all lies, you know.
No, you don't need to explain.
The first attack in Truro, that was real. I didn't know I'd get compensation, but it changed my life. Everyone patted me on the back, telling me what a hero I was.
So what went wrong?
I just got confused, you know, up in the head, and that's when I had the brilliant idea of, you know, what if it happened again? Not like the first time, nothing dangerous, you know, just through the arm, you know. I just really wanted to get that good feeling back, you know? What happens now?
I don't know. I expect the police will want to talk to you. But I think whatever happens, Luke, you need help. Psychiatric help. Believe me, I know what I'm talking about.
Thank you.
I'm out of here, she's all yours. Right, who's for the full English? Oh, go on then. Perfect way to unwind.
I'm off for a run. 16 miles.
Oh, here we go.
No, that's the way to unwind.
No, I prefer to unwind horizontally.
Hey!
Sleeping means sleeping.
Right, who's with me?
Yeah. Come on, Elma. Get running.
Do you know what? I don't know if I want this. Who's coming along?
So that's the night shift.
I heard about what happened. You all right?
I'm absolutely exhausted. What about you?
My feet are killing me.
Guys, you two out for breakfast? Yeah? Lloyd?
Maybe some other time.
Come on.
Do you know what? I'm going to give the black pudding a miss, guys.
Oh, come on, man. Black pudding's the food of the gods.
Yeah, and which gods would they be?
The gods of blocked arteries. Arthur and his good friends are lost.
I like that.